cause a lot of severe symptoms within 2 or 3 hours, up to 24 hours from eating this food. This will cause severe generalized abdominal pain. It will cause nausea. It will cause vomiting, and it will cause diarrhea. And you will feel, even that you are not a doctor, that this pilgrim is really ill and sick and needs medical help.
Inshallah.
And in this condition, you cannot do anything at home or in the campaign, so you need to take him to medical center. In this case, usually, we will put for this patient intravenous fluids. We will try to take some stool analysis to check if there is a special bacteria, like you mentioned in Salmonella, to give the specific medication for that. And you will give some symptomatic treatment like antiemetic and, let's say, replace the electrolytes and minerals until the patient will be healed, I think, within 2 or 3 days. And sometimes he will have also high-grade fever with these symptoms.
Right. Dr. Osama, you kept mentioning about fruits and vegetables consumption during Hajj. And we can understand that lots of the carbs as well that we may consume could be much more easier for our bodies to digest in comparison to some of the other foods which are processed or which are prepared in a different way. Now, is it a good advice for people to try to avoid meat and poultry products such as, for instance, eggs and chicken and those kind of things?
No need to, let's say, to avoid in that extent in this sentence, but if you to take a good and healthy food, the most important advice to cook your food or to eat it when you bring it directly from the restaurant. Prevent the bacteria from growing up.
And if you have leftover food, give it away to somebody or share it with somebody, but don't eat it later.
Yes, this is the most important thing. They made some statistics and they found that the most important thing for the food poisoning is